of tobacco and the impact of smoking is still significant within Warwickshire. This is even despite declining rates and number of people who do smoke. The impact that it has on your health is so significant, it retains a key public health priority. We know that people are receptive to health advice when we're in hospital, but yet we also know that historically very few quit attempts have started in hospital. And actually that's what the new Tobacco Dependency Service will help us to do. By supporting people at the point where they decide to make a quit attempt, by giving them NRT and by giving them advice, we can increase the chances of them successfully giving up.
I believe strongly in assisting patients in beating nicotine addiction, and this is because I have witnessed firsthand, as I'm sure many of you have, how an addiction to nicotine can rob many of their good quality of life. We see many of our acutely ill patients coming through to our emergency services with smoking-related illnesses like COPD, heart attacks, strokes and cancers, and many more debilitating and fatal illnesses. These long-term illnesses are detrimental to life-limiting symptoms, some of which we cannot reverse, which is why it is so important that we aid the patient so early on in their quit attempt in their journey. We aim for our service to help patients by treating the addiction to nicotine and in turn preventing further development of their smoking-related illnesses and hopefully improving their quality of life. In fact, we aim to assist in saving their lives.
This is part of the NHS long-term plan. It's one of the things that we're doing as the Trust's goal, and it's our big move towards prevention. And it's one of the things that we can do that will have a significant impact on the health of people in Warwickshire, preventing ill health and preventing people returning into hospital.
We aim to deliver the service at the patient's bedside with the assistance of our Band 4 specialists. They will assist with delivering that all-important dual therapy of pharmacotherapy and behavioural therapy. It is imperative that patients receive those therapies together, as for many patients it's not just about treating the addiction with medications, it's also about treating the psychological elements. This consists of addressing and adapting the reasons as to why they started smoking and awareness of how to manage their repetitive behaviours, triggers and habits that form with the addiction. And this can be treated through that all-important behavioural therapy. Data displays from historical services that treating one without the other has very minimal success rates. Treating both elements of the addiction together and within a hospital environment has seemed to have great success rates.
Benefits are amazing. I can breathe properly. I've lost my smoker's cough. I've lost all that smoker's phlegm. That was sort of within 2 weeks, 3 weeks. I lost all that phlegm, lost the coughing, lots of difficulty in breathing.
Now I'd like to take the time to say thank you for listening to our short video, and thank you to those that have referred and will refer.